everybody. Thank you for coming out this afternoon. Today we are here with Dr. Abby Mutic from Emory, and we're so excited to talk to you a little bit more today about the health effects of lead. This is kind of part 2 of our series. The first part we did back in July. We were talking with Dr. Sakawa from Emory, as well as some folks from the Georgia Environmental Protection Division about the environmental effects of lead in soil. And there were some questions that were asked that they wanted to defer because they did not have kind of that background in medical experience, and that's what kind of put us on the path to seeking out Abby and seeking out some more information about the actual health effects of how lead affects our body. So I am going to hand the mic over to Abby, and please introduce yourself.
Sure.
And tell us a little bit about what we're going to be talking about today.
Sure. Well, thanks so much for having me. Again, my name is Abby. I am a professor at the School of Nursing at Emory. I'm also a certified nurse midwife, and I'm here today to talk to you with my PEHSU hat, which is the Pediatric Environmental Health Specialty Unit. We are
So we love those acronyms, don't we?
Lots of acronyms.
PEHSU.
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 That's right.
Okay, great.
And the PEHSU is one of 10 across the country, and we're uniquely situated to talk to people about exposures from the environment, how they affect moms and babies and children, and also are able to really discuss kind of that clinical aspect. And so we can do the community stuff, we can do the academic, science-y stuff, and then the clinical stuff. So it's kind of a little niche. Today, it sounds like that you guys have had a lot of information about lead itself and kind of how it sort of came about to be in the soil. So I'm not going to do too much of a review, but if you want to skip ahead to what we're going to talk about today, I kind of just wanted to show you here that we're going to, just briefly talk about a little background of lead in soil, and as well as effects for families and children, and then briefly talk about kind of how the PEHSU can support moving forward.
Yeah, thank you so much. Just to kind of, maybe we'll do a little bit of a recap of what's been happening here on Unearthing Farm. I kind of get ahead of myself a little bit because I've been living it every day for the past, almost 6 months. We found out through Dr. Sakawa's lab that we did have high lead in our soil. We had previous testing that had taken place prior to any farming on the site. And then, we had some stewards who were farming, and this is about 4 years we had been farming on this property, having really great results. We had one of our stewards who looked at some rocks and said, that rock doesn't look quite right. That looks like slag. And, suggested that maybe we get our soil tested at that point. And of course I was, we were all like, yeah, let's get our soil tested. I mean, we've had it tested before, but, it doesn't hurt. And lo and behold, it did test high for lead. Our best estimate is that the reason it didn't test high for lead initially, and it did more recently, was because we had done some initial scraping of the soil and tilling up of the soil after that initial testing. So we assumed that maybe, over the years, maybe there was some lead fill that was brought in many, many years ago. And then, over the years, because we are in a FEMA designated floodway, the, erosion and whatnot, that there kind of was a layer of topsoil that was brought in, kind of covering everything. And so we stopped our digging in the dirt activities immediately, discussed with Georgia EPD and their risk assessment department about what was and wasn't okay, put a nice big layer of mulch over everything. We've been doing that multiple times since we found out, and just really drew back kind of a lot of our operation until we could learn more and get into the remediation part of things. Obviously putting signs all over the property, letting people know that there was lead in the soil, and to proceed with caution in that way. And so, you know, the one thing that we had a really hard time understanding is it felt like a lot of information was out there about lead in paint, right? Lead in some of these other materials, lead in the water, but lead in the soil, it feels like there's a lot of maybe conflicting information. We know the EPD and the EPA have recently lowered their threshold from 400 parts per million to 200 parts per million in terms of what they consider like an acceptable, you know, amount, or amount that doesn't require remediation. And so, you know, was wondering if you would be able to get a chance to tell us a little bit more about your research, of course, and what your experience is, but also, you know, has there been more discussion about lead in soil as a potential health hazard in your field? Is that something that you've seen more of?
So when we talk about exposures, we think about trying to give people all the information that is available in terms of where it is found, how it happens, and the difference in exposure for different types of people.
Mm-hmm.
And so to answer your question, clearly, no, it's not new information. It's not well talked about. I think that we did a really good job in the US with lead in gasoline and the removal of that, and being able to really decrease our lead exposure overall because of that. The statistics really greatly improved. And that's kind of where we stopped. We didn't talk about the other things, such as water, products that contain lead, foods that maybe are imported, that may be grown, especially spices and things like this that are imported from different really heavy lead areas, and in soil. So I do talk about lead in paint frequently because it is the main reason I think that most kids are exposed. But it's not the only reason, and I am so sorry that this has happened. It's devastating and very scary for people.
Well, I know we talked a little bit that you have a couple of younger children about the same age as mine. So I have two children, ages 8 and 11, who have spent the past 4 years on the farm. And I remember the first day that we got the news that, you know, we had this high lead. I just had this deep, shocking moment where I thought about all the times my kids had covered themselves head to toe in the dirt on the farm, that, you know, all the things that I really enjoyed about the farm, that I felt like I was giving my kids an experience, and I just had this moment of like, did I poison my children? We immediately went to the pediatrician and got a blood lead test, which came back, you know, it was the fast test. So
The finger stick?
The finger stick. It was a finger stick test, and immediately came back with, you know, no lead or negative, or how, I'm not exactly sure of what not detectable maybe is the word. And of course that was a little bit of relief to me. But one of the things that I was interested in understanding, have you talked a little bit or researched any about the difference between kind of like the acute or short-term exposure of lead versus like the long-term exposure of lead, because one of the things we had heard is that maybe blood tests are good for kind of understanding that short-term exposure, like if it happened within the past month or 2 months. But if we're talking about, you know, lead exposure over time, or it may have happened a while back, it's not that there wasn't negative effects, it's just it's no longer in our bloodstream. Am I explaining that correctly, or do you have anything?
It is tricky to understand. If you will scroll to the one that talks about, it has a little thermometer of exposure numbers there.
Yeah, that's it.
So we talk about health effects related to the type of exposure, meaning if it was all at once or if it's like slow and acute over time. And the reality is most people never know that they've been exposed. And it's very difficult to track down when the exposure occurred. That's why in the US we have requirements for pre-Ks and school-aged children that are going to like a Georgia-specific Head Start, but other states as well, that they get screening tests. And this is because we know that part of your pediatrician visits should also be screening for lead, but some fly under the radar or don't make their appointments or things like that. So we also try to catch them at that pre-K time point as well. But again, it doesn't necessarily tell us when that exposure occurred. When we're talking about the amount, the U.S. has now decreased their concerning level from 5 to 3.5 micrograms in blood. And this is very, very, very good news. We were thrilled that this happened because we're seeing that the average across the U.S. is around 1 to 2. But anything above that was really getting kind of poo-pooed for a long time. And we know that there is no safe level for lead. Your blood work should really be 0 or non-detected. When we see that kids have been exposed or large amounts at one time, you know, we may be able to trace that back to an exposure time point. But otherwise, what happens is your liver and your kidneys work really hard, and you tend to store some in the bone, and then you excrete kind of over time the rest. Or you need treatment, which is called chelation, and it's a treatment that binds the lead in the iron, and that's how you can get rid of it. But we can never really fully get rid of what's in the stored bone. And so specific times of one's life can activate those bones to release some. There's nutritional deficiencies that can occur that will increase the lead to be kind of recirculated in the blood. Puberty and menopause, pregnancy, these are all kind of events that can also increase that blood flow to circulate more of the lead that was stored. But for the most part, lead stored in bone is not causing a health effect. So that's good news, even though we can't necessarily get rid of it from the bone.
Yeah, but that does give us at least maybe a point that we could measure. And I know that in Dr. Sakawa's lab, they are working on measuring the lead in the bone. And in fact, Unearthing Farm has signed on to do some research with Dr. Sakawa's lab. Our stewards are very excited about, you know, potentially contributing to that research and doing this bone scanning to figure out, you know, if they have any elevated levels in the bone. But that's very interesting to note about how just because it's in the bone now doesn't mean that it's always going to be there, that it could be reactivated, you know, later in life. So that's a really interesting Interesting thing that we didn't know before. Now, you did say, is there like a good, what you would say would be a normal like timeline, for the blood tests to, measure, like if there was an exposure, do you generally say, that would show up in the blood for a month, for 2 months? Is there like a period of time that you would say that the blood test is kind of like an accurate measurement for?
Not necessarily. I wish that I could give you a really specific answer, but it really has to do with the amount of the exposure. So, for example, if someone tests positive and their level is 3, and the next person tests and their level is 50, the person that has the higher level is going to actually be positive for quite a while, because the body is not going to be able to get rid of that quickly. The person that's 3 would most likely get a repeat test in 2 to 3 months, is probably what the recommendation would say.
Right.
And we do follow it. Once they reach a certain threshold for their age group, we will follow that over time, making sure that it does decrease.
And I know that like your work is more focused on pediatrics. Obviously that is, I remember obviously as a parent, we talk about children, I think for a lot of reasons. One being like they're the ones that are more likely to, take something and eat it that they shouldn't, right? Whether that's a chip of paint or whether that's a big pile of dirt, right? And that is typically how we, get lead in our body is through ingestion or inhalation. But it also affects them different. It affects children differently than adults. Is that correct? Or could you talk a little bit about like the differences on how like lead affects children versus adults?
So if you think about it, you're right in that their activities, their behaviors, kids are lower to the ground. Most of us are not getting in the dirt and playing, right? So there's just certain behaviors and certain things that they do naturally that causes them to be more exposed. They're also breathing faster per minute than we do. And so the fact that they can actually breathe in lead quicker than us is true. They can also eat lead at higher rates than we can because their body mass is so small. So we may eat the same amount of lead, you and I, as a child, but the fact that this child is so much smaller, their body mass is not very much, it's a huge dose for them. So you can kind of see why they're more vulnerable in a lot of ways. But they tend to suffer more from health effects as well because their bodies are still developing. Their immature lungs, for example, the lung tissue is not fully grown and adaptable. It's still developing, and those cells are still dividing and growing. And same thing with the brain and all of the organ systems. The hormonal system is still developing and not fully functioning at its max, like adults are. So there's a lot of ways in which lead can impact the development of a child that adults don't have that same level of impact.
Thank you. I think that makes a lot of sense. When we, what are some of the kind of stopgaps that we currently have, implemented in our system to help us detect exposures, both for kids and adults? Like, are there any, for adults? And then what would be some stopgaps that you would like to see that, we as a group should, potentially advocate for in the future?
Those are great questions. And I tend to be on the more conservative side because I see that the impact is huge. And so I would love for all pregnant people to be tested as part of their routine labs, because we test for a lot of things that we have learned over time are dangerous for
And so
pregnant
that's
people.
not currently being done, and that's not part of.
It's not a screening test for pregnant people.
Interesting.
And we also know that pregnant people's physiology just changes dramatically when they're pregnant, and so if we're able to fix something right away that can really impact a child's brain and development and learning, like, why aren't we doing that, right? I feel the same way about things like thyroid, which we are not testing enough because we have to have certain things in place for the baby to develop well, and so that's one thing. But we do a good job in our pediatric clinics of testing and screening all children around age 1. I think that is the only thing that is clearly becoming a standard. After that, it has to do with exposure, with risk categories, and standards of the school system. And so that's varying across ages, across communities. So it's not standard at all. It would be nice if it was.
Yeah. Interestingly enough, I recently had my physical done and, requested lead as part of my blood work, and, as far as I know, there was no additional cost to me. I mean, it was the blood that they were testing anyway. So it seems like an easy fix all around if we were able to do that, just like they do for, I'm sure they're testing pregnant women's blood for a variety of other things. So that seems like an easy thing to address, so maybe something we should continue to advocate for. So one of the, can you tell us a little bit more about, what brought you to this kind of exposure work that you're doing now? I mean, obviously you have this midwife background, nurse practitioner. Obviously we have, which Emory is well known for both of those fields. But what really kind of, it's not necessarily what you would expect someone with that background to be working on is this environmental exposure. So can you tell us a little bit more about how you got there?
Yeah, so I was working as a full scope midwife in Missouri, where I was taking care of a lot of people that were in rural areas and working in factories, farms, married to farmers, a lot of different types of occupations that is unique to some of the rural central west of the United States. And I was receiving a lot of questions that I honestly didn't know the answer to. And it was things about their exposures and things about their work styles, their workflow, and if it was okay. And that's kind of the golden question that all people want to know is what I'm doing okay for the baby? And is there anything I should do different? And for some of the questions, I really didn't know the answer because I wasn't equipped in environmental health at the time. So I started really becoming more and more interested in this idea that everything we come into contact in our environment could potentially be harmful. And we don't see most of our exposures. And in fact, pregnant people are exposed to over 200 chemicals a day. And they don't even know. And so we're really coming into contact with various types of exposures that some probably not so bad for us, others really bad for us. And I don't think we talk about it enough, and we don't know about it. And it is kind of a dark, gloomy topic. But one that I became really interested in, this niche between my prenatal and GYN background, and then early baby growth and development, and it's kind of where I nestled in after I got my PhD in this field.
And so, could you tell us a little bit more about your specific research and what it has focused on up to this point, and maybe what you're hoping to do in the future with that?
Sure. So my research actually is focused on indoor air and the things that we breathe on a natural daily basis and how that may affect certain outcomes for kids. So most of the time people are pretty concerned about respiratory conditions and early asthma. Preclinical asthma is kind of what we call it when a lot of clinicians don't want to diagnose asthma in early learning centers and kids that are really young, and yet they're developing asthma as
Why
we
don't they
progress.
want to diagnose asthma? Yeah, what is that about?
It's because kids are obviously growing and changing a lot in those first few years, and they become exposed to a lot of viruses and bacteria naturally in the school systems, and so their immune systems are kind of catching up, and so they don't like to give a diagnosis because they may grow out of it, is what they kind of call it. This idea that their immune system will get stronger and compensate for some of these symptoms that they're having and these viral illnesses, etc. So they really want to be confident before they give that diagnosis to families. I think there's a different way we could do it and still be safe and not, scare everybody. But yeah, so my research really looks at kind of where kids are going to school, especially that 0 to 5 age group and 0 to 6, and what they're doing in the classrooms, what they're not doing in the classrooms that may be contributing to some of their exposures and learning outcomes.
It's very interesting. Speaking of exposures via air, right? What we have learned, and feel free to add to this if there's something that I'm missing here, but really, you could sit here and like touch, I could rub on like a lead rock all day, right? And I would be okay. I'm not necessarily, unless I break the skin, I'm not necessarily hurting anything. But it is either the consumption or the inhalation of lead is how it kind of gets into our bodies. And we're getting ready to go through a remediation process where they're going to be coming in with huge machines and ripping out, thousands of pounds of dirt on a daily basis, and that can go up into the air. Have you had any experience with the understanding of lead as an inhalation exposure and what that looks like compared to kind of the consumption exposures? What type of situations do you typically find where that lead is airborne and people are inhaling it?
So I can't tell you that I don't think people would be exposed from the remediation process. I think that it makes a lot of logical sense that the hired staff that are going to be coming through here may be exposed. But the cool thing is these people are lead certified and they know what they're doing and how to protect themselves. It's the rest of us that need to make sure we stay away during that time. But most people, when they are exposed by breathing, it's not usually from the soil, because most of the time when we interact with soil, it's playing with our hands, right? And most kids don't eat soil. Mm-hmm. It can happen, but that's not usually what happens. It's usually the paint chips, old houses, and also being near streets where they have gasoline and maybe aviation fuel, things like this that are often located near certain residences or businesses that can leach into the soil itself. Old houses that have the paint that chips off is not well cared for, and so that's where it kind of will fall all around the outside of the house and can be a higher exposure at that kind of closer to the house itself.
Yeah, I know one thing that we had asked about, and they said that they would be putting out some sensors that should be able to detect if there is, a high level of lead in the air as part of the remediation process. But, again, a lot of us, this is all brand new. And even the idea of there being lead in the soil has really just kind of been something that has only recently occurred to me as a problematic thing. But of course, it's happening all over the city. As many people know, the West Side Superfund, they've identified, I think, like 3,500 properties over there that are above the threshold and need to be remediated. So we do know it's a problem here in the city of Atlanta. I wanted to give an opportunity to see, I know, did anyone from the audience potentially have any questions for Abby? I wanted to double check on that. Okay, we have a small group here today, but the last really thing I wanted to talk to you about was in terms of the health effects of lead. What are some of the things that we should look for? If we think we have been exposed to lead, what are some of the symptoms? What are some of the things that can happen to our bodies or to the bodies of children if they are exposed?
So, with all exposures, it really has to do with the amount of exposure at one time, or is it low and chronic? In terms of lead, we generally classify it as like very high and dangerous, which would be anything over 100 micrograms. But that is very, very rare, and those kids are going to end up showing up at the hospital because they may have like swelling on the brain, and it is very life-threatening. High exposure, obviously, still a problem. We kind of classify that as something around 44. I don't know why that number 44 exactly. I think it has to do with the cutoff of those studies. But anything over 44 is considered high and also problematic, but they're really not specific outcomes to look for. The things in the literature have been things like anemia and very interesting symptoms like GI symptoms, nausea, constipation. You wouldn't necessarily pair that with a lead exposure, right? And then we really think about this low, steady, chronic problem, and that is what we see more associated with learning and disabilities and behavior outcomes.
So, from whether it's a child or even an adult, we're thinking stuff that more has like a behavioral or mental, potential impact, is typically like what we may see in someone who has those levels of exposure.
And so because of that, it's not something that's gonna be like ding ding ding, oh, we need to go to the doctor, right? And so we just wanna make sure that people are aware if they have been exposed, like folks that maybe routinely garden and eat here over the last several years, like they're gonna probably wanna get their blood tested a couple times. Because it's good to make sure that you're following it, especially their kids, their young kids. And it's not something that we can't handle. So it's find your pediatrician, make the appointments, and really follow that lab over time, and it'll be a lot more reassuring.
So this is my final question for you, because I think about what I've started doing more of since I found out about lead on the farm, And my biggest thing is I've been much more diligent about taking my shoes off before I get into the house. I wonder, kind of, I think it's really difficult when you work in these type of fields, because I feel like it would be very easy to kind of see the boogeyman everywhere you turn, right? Because you're always reading about like the worst case scenarios. But what are maybe some things that you do because of what you know about exposure that you didn't do before?
That's my favorite topic. Because we all want to know, what can I do? Because this feels so out of control sometimes. Simple things that we just don't probably pay enough attention to, such as making sure we wash our hands a lot. Anytime you're out here, washing your fruits and vegetables before you eat them. Washing them when you get them from the grocery store. Give a good friction to it. It's not just rinsing it underwater. It's actually the friction of a sort of a wash with water that helps it to be clean and cleared of pesticides, especially. So I'm really focused on washing and things like rice. So we don't talk about this in the U.S. that much. And I have a friend that is from Korea, and she said, oh, I know. Some of my American friends don't wash their rice. It's disgusting. So really scrub that rice. Really good. Because it does have residue on it, and it's not healthy for us.
I worked in international commodities trading, and the things I could tell you about those shipping containers would probably give you nightmares. So yes, I absolutely agree. And what you mentioned about spices was really interesting, because especially anything spices, any type of like flavorings can be like this too. Anything that you have to like kind of concentrate down, or you've kind of concentrated into like an essence or a smell or a flavor of something, that's when you can actually get into some really high levels of contaminants. And a lot of these things are coming from different places all over the world. So I think that's I agree with you. It's really important. And the cockroaches and the rodent feces is not the worst part of it.
Another fun tip is get an air filter, and one that's HEPA filter, and run that throughout your house as much as you can. It really will help clean up the indoor air contaminants and pollutants. Sometimes our indoor air is more contaminated than the outdoor air. And if you think about it, it makes more sense, because we are all right now in this one small space sharing whatever's circulating in here. But if we go outside, the air circulating has the chance to move pretty quickly with the wind, and there's just so much more space, right? So we want to think about our indoor air and make sure that we're changing our filters every 90 days. Yes, 3 months. Sorry, I had the 3 in my head. Every 90 days, changing our HVAC filters and our air filters for our little portables, because they're catching things that aren't going in our lungs, and that's super important.
I'm sorry, I did say that was my last question, but I did have one more that I just remembered I wanted to ask you. In terms of testing for contaminants in your water, or in, you mentioned the air filter, but like specifically as we talk about like the health of our water, we know City of Atlanta's water infrastructure is not great. Of course, most of the problems are on the other side, or on the sewer side, but what would you recommend for people, who are concerned about like what might be in their city water? Yeah.
So, great question. When we think about water exposure, you want to know, is it city water or municipal water, or is it well water? Very different, and they can have different kinds of exposures. The city will put the reports out, and you can find them online on their websites for their latest reports and see what they were testing positive, or if they were testing positive for anything. They are required to let the consumers know if it is something of danger, but you will be surprised that there are some warnings out there that are not communicated to residents. When we think about lead, we know that lead is not coming from the municipal cleaning system. It's actually coming after it leaves their facility. So somewhere in the pipes, or in the way it sits under our house or comes out our faucets, that there may be an exposure through that section. And so there are some pretty easy tests that you can have done. There's two types. One that you want to let your water run for a minute or so and then test it, and then you want to test the other one right when you turn it on. So that tells you a little bit about what's been sitting there and what's coming from a little bit further out. They're not that expensive tests, and there are some pretty good not-for-profit agencies that will test water and soil for residents. So that's something you can find out if you're interested.
And maybe we can get that information from you and possibly share after the fact. Okay. Well, with that, I think we are about at time, so I just want to thank you again for coming out and answering these questions.
I did have one thing too that I remembered we haven't got to yet. There's some nutrients that can help bind lead quicker. And so
this is lead in the body?
Mm-hmm, in the body. And so vitamin C, iron, and calcium are things that we want to make sure folks are getting enough of with regular fruits and vegetables, and if not, they can take an extra supplement. And that will help bind, and we recommend that to all of our kiddos that do test positive, and we need to watch over time. We recommend that they get that extra supplement in their diet.
That's really great information, so thank you for taking the time to share that with us. And yeah, we hopefully will have you back again when we have our grand reopening in the spring.
Exciting.
So thank you guys so
Thank
much.
you for having me.